Okay, so the article I'm going to be reviewing was entitled Prayer and Healing, a Medical and Scientific Perspective. So this article started out by discussing some of the benefits that prayer and meditation have been shown to have on the healing process. So just a couple of the ones that were mentioned were reduced heart rate, regulated blood pressure, they boost immune system, other beneficial things such as that. Prayer and meditation are also shown to work much like the placebo effect. Studies have been shown that it works in heart disease and heart failure, obsessive compulsive disorder, anxiety, depression, Parkinson's disease, and even cancer. So the main body of this research study was to see if prayer can be shown in research effects to be beneficial or to have no results or to have negative results. There were four main experiments, and these are how they played out. The first showed improvements with prayer. So the test included 219 infertile women. It was conducted in Seoul, South Korea. The treatment was done with in vitro fertilization. These women were put into distance prayer groups. The prayer groups were in the United States, Canada, and Australia. And the patients were not informed that they were being prayed for. So, after the trials are over, the women who were in the prayer groups were found to have a 50% higher fertility rate, and their implantation rate was also higher. The second study showed an absence of benefit with prayer. 799 coronary patients were prayed for once a week for 26 weeks. If they were to die or have a heart attack during the process, then they were basically considered a fail, and their part in the experiment was over. At the end of the experiment, approximately 25% from each group were terminated before the end of the process, so it was really shown that prayer had not a lot of impact in this particular experiment. One experiment showed to have a worse outcome with prayer. There were 1,802 coronary artery bypass surgery patients. 2/3 of them were told they may or may not be prayed for. The other third was told that they definitely would be prayed for. So prayer was offered for all of these patients once a day, beginning 1 day before the surgery and continuing until 14 days after the surgery. The prayer was conducted by multiple people at an religious institute. So at the end of this, the 15-day period, complications were found in 52% of the group who was not sure if they were being prayed for, and 59% of the group who showed they were being prayed for. So there was found to be adverse effects in the group who was positive they were being prayed for, opposed to the one who was told they may or may not have been prayed for. The final experiment was done with 3,393 patients with a bloodstream infection. This one was done in a long term, over a period of 4 to 10 years. So these patients were being prayed for. There was little information given, so some were being prayed for once a day, once a week, once a month. The information was varied. and not very specific. So, the study showed that those who were being prayed for regularly were shown to have fewer visits to the hospital. Their visits to the hospital shorter, and when they had fevers, the duration of the fever was shorter as well. So, in conclusion, this paper, it showed that in some instances, prayer did absolutely show to improve the physical well-being and the healing process of the patients, but it was not extremely consistent. So, it can't be thoroughly proven to be, or reliably proven, I guess. But it is scientifically proven that in some cases prayer does improve the outcome of procedures. So that's what I have.